Hey everyone, today is going to be a bit special. Before I go and finish up the specific self-care series, I wanted to actually go and re-record and re-release a few episodes at a higher quality than what they were first released in. This is episode 3. This is the first episode where I really get into the nitty-gritty of the specific self-care for your body, because the first 2 episodes were just really the introduction to this channel and to this series. If you can recall, one of the problems with this original episode was that I had it on a really small screen and the sound wasn't as high quality as it could have been. Now that everything's been upgraded and I've made the necessary changes to make sure that the video is good quality, I want that video to be tolerable for everyone to watch, including myself, because I'm a person that could watch videos of myself talking and have no problem with listening to the voice. I know some people actually do have a problem listening to their own voice, but that's not the case for me. But in this case, with those original videos, it was really painful for me to even watch, so I need to recreate those re-releases for you and for myself. For those of you that have been here since day one, bear with me as I reproduce these higher quality videos over the next few weeks. But don't worry, part of the reason I do this is not for the channel as much as I do it for my clients that I see in person. You see, one of the benefits from working with me, whether it's massage therapy or personal training, is that these episodes that I release, the clips that I release in between the episodes, those become personalized self-care as homework for my client. So it helps me get them to their goals and helps them stay injury-free. So this is why the content of the self-care series is the most important content for me to release. Don't worry, I'm going to keep coming up with ideas. So once the self-care series is done, we're going to have fun covering up other topics in the human body, massage therapy, and athletics. And what I'm going to do as I'm re-releasing this content is that I'm going to throw in some new content in between the re-release of the old content just to keep you satisfied. Anyway, let's do the intro and get started into episode 3 of specific self-care series for your body. So today we're going to be going over the lessons and self-care techniques along with the proper form that you need to take care of the muscles that start in your forearm, cross the wrist, and go into your hand. We're going to do stretching and mobilization drills. These are going to help you get those results, and I'm also going to help you distinguish which are better for warm-up and the start of your day and which are better for cool-down after workout and at the end of your day. And I'll help you understand the difference to get the best results from this video, because wrist pain is going to come at some point in our lives, no matter who we are or how active or inactive we may be. Some of this pain is just simply due to the fact that in society, everybody seems to work with their hands, even though working with your hands can mean totally different things based on your industry and how you use them. First off, one of the ways that I like to see or like to think of people working with their hands is the more old-fashioned way that involves physical labor with the hands. So it can be any type of movement that would involve grabbing, hammering, pushing, bracing, and even more. And the second and more modern way of working with your hands is like sitting at a computer, a tablet, or even a piano for long periods of time with the hands spread open and not moving the hands and arms too heavily. One involves strength and repetitive motions. The other involves endurance and repetitive motions. And either way, they're going to cause tightness. One of the things that you have to do is that you have to develop a good self-care routine, because these muscles are overworking, so that repetitive motion is not going to go away. You need to take care of it better. So you could be hammering all day, you could be climbing, you could be pouring drinks on a 6-hour shift, and you still need to take care of them, bartenders. Dave, you better tell Richie and all those people at Cronin's. You know, so what we have to do is we have to take care of the muscle both at the end where you might be feeling pain, but then also in the muscle's belly where you're really going to be taking care of the trigger points and adhesions in the muscle and the fascia, because both of those will shorten, they'll cause dysfunction, and then that'll go and cause pain. Now, before I get into the specifics of each particular technique, one of the things that I did notice recently is there's a lot more people watching this video than are subscribing. And in order for the video to get to new people, subscribers helps. YouTube algorithm also likes it when you give likes. So make sure that you subscribe, you hit that like button, and if you want, make a comment. Let me know what you like about this video or previous videos you watched, or perhaps you want to see something in the future. You want me to cover a particular topic. Let me know. An important concept to understand when focusing on self-care of your hand and your wrist is that these muscles need to also be cared for by working in your forearm as well. The forearm muscles are especially important, and it's because those muscles in your forearm, many of them cross your wrist and they connect either into your palm on the carpal bones or into the digits in your fingers. The muscles that do this, they can be divided into three categories easily because there's a lot of them. So those categories are the carpi muscles, the digitorum muscles, and the pollicis muscles. The pollicis muscles are the ones that are in your hand that help move the first digit in the hand, which is also known as your thumb, right? So they create all that diverse movement. The second group are the carpi muscles, and they are located near the elbow and at the elbow, and they go down distally into the forearm and go past the wrist, and they connect into the carpal bones on your palm. The digitorum muscles are the third group of muscles that they start at near or at the elbow joint, and then they also proceed distally down the arm, and their ending point is into the digits, aka the fingers, and they help produce movement both at your fingers and at your wrist. So to see results in your hand and at your wrist, you have to work at the area by the elbow and work down to the fingertips as one complete unit to get the results and reduce the pain that you're probably looking to do. Now, what I like to do is I like to work on two sides, which are known as the flexor and the extensor side of the palm and the forearm. Now that you know this basic concept of the muscles and how to approach them and how to care for them, let's talk about the tools that you're going to need to have to perform everything that I'm going to teach you on this video. The following tools are what we're going to talk about, but I'm also going to talk about the spacing because I think it's important that you have the spacing down for this lesson. Also, if you need help with purchasing anything, I have left links in the description down below to make it easy for you to get what you need and to follow along with those tools. Most of those recommendations that I will be making, they can all be found on Amazon.com. Just all you got to do is click the links below, and whether you're on desktop or you're on mobile, you'll be taken to Amazon, and it should be easy to put in your cart from there. So first thing you're going to need is a comfortable space where you can sit on and watch this video, but you're going to also want to have enough space in front of you to perform what I show, whether it's a coffee table or something like that. Some of the stuff you can do on your lap, and I'm going to do some of that work on my lap, and the target area in other stuff is going to be much better done with the help of a table. When you use a table, one thing I want you to do is make sure that's strong enough to support your weight. One arm might not be a lot to break a table, but two arms, along with therapeutic force that you're going to produce to help release the muscle, that multiplies the pounds of pressure that are put on a table. So make sure that your table is of decent quality. You've been warned, no cheap tables, otherwise it's going to look like you're in a wrestling match breaking tables here. Second, you're going to want to have a tennis ball, a therapy ball, or a lacrosse ball to work like the larger areas, such as the areas like in your forearm. And then third, what we're going to need for the smaller myofascial release, such as the areas in your palm, you're going to need smaller therapy balls. What I'm going to use specifically is the Melt Method brand of therapy ball, but any therapy ball that you should find, it should be able to work, no problem. However, if you want to have a surefire thing that you know is going to work, just get that brand. Make sure you have it at home, so when you follow along, it'll be a little bit easier to do the exact work because you're going to have the exact tools that I use for these techniques. Hand compressions. One of the simplest and most satisfying techniques, I believe, is providing yourself with compressions in your hand. This is a great technique to use to take the tension out of the fascia, but it will also take the tension out of the smaller and larger muscles in the hand. Some of those muscles that it can help, which are the ones that are deep and are in between the long bones of your hand, which are the interossei and lumbrical muscles of your palm, but then it also gets stuff that's a little more superficial, like the digitorum muscles, the carpi muscles, and the pollicis muscles. I'd go over all the muscles in your hand, but honestly, there's just too many. It's better to talk of them as groups, and if I was to actually go over all of them, then that's a whole video for a whole nother time, because I would honestly take away from the content of this therapy and this self-care video. Anyway, let's get back to the technique. Hand compressions. They're better done as a cool down. Yet, if your hand is feeling really stiff, you can do it in the morning or like as you're at your desk. This can be done with or without a table. It can be done seated or standing. The main thing that you need to do is take your working hand and you're going to create a C shape with it, right? Whether it's a forwards or backwards C. Now, what you're going to do is the back part of your hand is going to get tension as well as the palm side. The back side is actually known as the dorsal side of the hand. So you're going to be given about an equal amount of force of compression on both sides. And what you're going to do is you can pick with either working along the pinky side of the hand or along the thumb side of the hand. Now you'll take your C-shaped hand and you're going to create pressure, still pressure, and it's going to be a pressure that drags away from the center. You're going to compress and you're just going to hold on that receiving hand with that downwards force that has a little bit of drag that moves away from the center of the palm. You hold and you breathe. Then if you want, I just did one that was deep on the thumb side. I'll move a little bit more distal and I'll squeeze again. Distal just means further away because it's looking at it as further away from the center of your body. Proximal means closer to the center of your body. So when I use those terms, for those of you that are new, that's what I mean. Now what I'll do is I'm going to switch and I'm going to start on the thumb side. And same thing, I'm going to take that C-shaped hand. I'm going to come, oh, I fell off camera because I like to do it near my waistline normally, but I'm elevating just for this example, and I hold and I squeeze. And same thing, I'm creating force that moves away from the center of the palm, and I hold and I breathe. And if you notice too, I'm trying to open up my palm away from where I'm holding to stretch out the fascia and the muscles a little bit more. And then same thing, I can move just a little more proximal, a little more distal rather, and hold and breathe. And just like that. And if I wanted to, I could also get along there and do a compression, hold and breathe. 30 seconds is good. Then when you're done, you can repeat on the other side with the other hand, same thing, just opposite side. Now the working hand is the C-shaped side. You'll do the same thing along, like let's say the pinky side. Then you can do the thumb side, and then if you want, you can get that little space in between the thumb and the index finger, and that will be how you do the compressions on your hand on both sides. The following technique that we will review is one that I learned while I was a student studying reflexology. And when I studied this, I realized that this technique should not be exclusive to the study of reflexology. More people should know this technique. The name of the technique that we will go over is called the palm piano key technique. This technique can be used as a warm-up, or it can be used as a cool down to help mobilize and stretch your hand. The piano key technique can be used for both the anterior and posterior sides of the hand, and not only does it do that, but it also loosens up the muscles that are found between the metacarpal bones in the hand, and which are the long bones in your hand, and it really is a good one to provide comprehensive relief to both superficial muscles and deep muscles along with the palmar fascia in your hand. Anyone that does labor, manual labor, like I had talked about earlier, they could really benefit from doing this technique once to twice a day. Help warm up your hand And then also at the end of your day, just to help mobilize and prevent it from getting like chronically stiff and having pain or dysfunction. If this sounds like you, then you might just want to include this technique in your self-care routine after you put it to memory. So to start this technique, we're going to find the area of muscle that we're going to work on. The area of muscle is the meaty part that's located between our fingers. So we're going to slide our hands into the meaty part of our fingers. That's a straight line down from the gap between the fingers. And then that will help us divide the area into 4 areas that we could work. So what we're going to do is when we start this, we're going to perform the action, and it's going to look something like this. So my index and my thumb on the working side, they are just gently going back and forth. And if I want, I could just move up and down that long bone, the metacarpal bone, and just mobilize. And I can do just like this for mobility, or I can just push and hold to create a stretch. And just like that, my middle finger doesn't get as much mobilization, but as we go through them, you'll see that some areas vary more than others. And then once you get too far into one palm, you can just approach it like that. And you can even do that work, even though it'll feel a little bit different, you can still do the same mobilization even to your thumb side. Then when you're done, you switch to the other side and you begin again. So just like that. Before I showed you the palm side, but I can do it so it faces the screen just like this, and you get to see it a little bit better. And you create the mobility just like that. Switch, keep the palm relaxed on the side that's receiving the work. Because if you stiffen it up, you're not going to be able to get any mobility in there. So, your working side works, those muscles are tense, the side that's receiving is very relaxed and it's just receiving. Breathe deeply as you do this, that helps. And then when you're done, you can put your hands together and relax, or you can move on and do another activity or stretching drill for your hands. But either way, you'll have completed the palm piano key technique. Thanks for tuning in. I'm going to now show you how to use these tiny massage balls for the smaller aspects of your hand to provide relief to anywhere that you might have tension or trigger points. I like to use a custom set like this because these smaller balls, what makes them different from the tennis and the therapy balls along with cross balls is that they're smaller. So one of their main designs is that the other ones can't do is that they help you get to that smaller area, the smaller muscles between the bones in your hand. So like I mentioned earlier, the brand that I use, that's my go-to brand, is the Melt Method brand product for the therapy balls that I use on both my hand and my foot self-care at home. I put links in the description box down below for you to buy a set if you really need a set. All you have to do is scroll down, you'll see it where it says the Melt Method balls I use. It'll take you to Amazon.com and they have enough that are ready for you to make a purchase. So now, let's take our favorite Melt Method ball. I like the firmer one, the harder plastic one, and that's the one I'm going to use between my palms. This comes with varying densities, so you can adjust your body as it adapts. Now, I picked the firmer one because I'm well adapted, but you can have a softer one for those of you who are new who might have a lot of tension, right? Now, the two ways to do this are by making circles or making lines of pressure that are active, right? So the making circles done, it's really good for the palm side. And what you do is you take the ball and you're going to make small circles. Work in the area. You can put emphasis on the areas where it feels tight and continue to make your circles there. Otherwise, just go around. Then the other technique is making lines. Now this one is better for the backside, the dorsal aspect of your hand. You do this by taking the ball, putting it in the palm that's going to be working, and then you're going to slowly create active pressure, going between the bones of the back of the hand and moving it up and down in a gentle but firm motion. You won't cover that much area, and that's fine. because there's less muscle exposed in this area. I put my hand against my chest just to create a little additional pressure. I go and I create those lines up and down, going along my palm and the back of my hand rather, palm's the other side, and as I switch, if I don't pick up the ball, one of the things I do is I'll roll over the bone, but it's like a pass. There's no pressure like when I'm going between the bones. You'd never want to put the pressure on the bones because you can cause damage. Then, after you do that, you can switch. I'm going to do the same thing, but to the other side. So, my left hand's going to be the side that receives. My right hand's going to be the side that works. We make little circles. We do those circles like we're rolling a little ball of putty and making circles out of it, except the putty is the muscles in our palm that's receiving the work. And we create those circles. Then we do the lines. Like I said, we can rest it up against our body, go in the area that's between the bones, and then create pressure. And just go up and down with a relaxed palm, creating that pressure. Stay on the muscle, don't create pressure on the bone. Go up and down, switching into those different zones between the bones, and just work it. Release those muscles, get some blood flowing there, release the tension and breathe. Then once you're done, you have basically used a therapy ball to help release any tissue in the front and the back side of your palm. Thanks for watching this one.